what you see the current trends in the aesthetic market?
They don't want anymore the big lips, the big boobs, the huge butt. They want an enhancement in their shape.
For men's too, like they get their muscle mass, they get their hardcore.
There's a new technique, it's called U-graft. It's ultrasound graft. So we can create muscles. You are making them bigger in a safe way.
They think that we should not need to modify our lifestyle.
There's no risk related to plastic surgery, but there's a risk related to selecting a wrong doctor or a non-plastic surgeon doing the surgery. You burn a lot of energy after surgery, so you have to have a high protein diet, and later you have to maintain your weight.
Assalamu alaikum, good evening, welcome to Dr. Essa studio. Today we have an amazing guest. I can't wait to introduce him because he's the person which make you beautiful, and he is the one who make the other persons in the limelight. So we have Dr. Jory, a plastic and reconstructive surgeon who serves in a lot of countries like Beirut, Dubai, Qatar. So he's with us. Welcome to the podcast.
Thank you so much. What a great introduction. Thank you so much. For
You're
these kind
always
words.
welcome, and thank you so much for your time. That matters a lot.
It's an honor being here. Thank you.
Okay, all right. So first of all, please tell us and share your journey, our story, like how you be into the plastic surgery and why you choose reconstructive surgery.
So it's mainly I do aesthetics. I don't do reconstructive anymore, but I did my specialty in plastic and reconstructive surgery. So I did my med school in Lebanon. It's an university, it's French university. It's called St. Joseph University. Then I did my plastic surgery training between Lebanon and France. I went to Hôpital Saint-Joseph, which is St. Joseph Hospital in France. I spent around 2 years in France, in Paris. Finishing my plastic surgery specialty in Paris, I got the opportunity to work in the United States. So I went to Dr. George Bitar, which is Bitar Institute of Plastic Surgery. It's a huge aesthetic facility in Northern Virginia. They do a lot of surgical and non-surgical procedure under Dr. George Bitar. So I spent a year as a fellow.
Great.
I had the opportunity to stay in the US, but I said no. I wanted to go back to my country. So I went back to Lebanon and focused more and more on body contouring. So now I consider myself a specialist in body contouring. I'm a member of the International Society of Plastic Surgery, responsible for body contouring in the Middle East. And actually, I'm a trainer for InMode. InMode is a company that got us Morpheus and Body Tight and all of these technologies that tighten the skin and quantum. So I'm an international trainer. Hence, that's why I'm here in Pakistan.
That's great. That's great. That's amazing. That means globally aesthetic revolve a lot. So what you see the current trends in the aesthetic market?
That's a great question. I think you've seen it more and more. There's a trend nowadays to go more to natural.
Yeah.
So before we had the Kim Kardashians, the Nicki Minaj, that look. Nowadays, even the Kardashians are going back to natural, and we see it with our patients. They don't want anymore the big lips, the big boobs, the huge butt. They want an enhancement in their shape, but they want it to look athletic. Yes. So I think this is the trend nowadays in plastic surgery.
And this is about women's, and what about men's? Like on the last event I saw, there are a lot of amazing aesthetic procedures for men's too, like they get their muscle mass, they get their hardcore. So what are the current trends in the men market is going?
And men are forgetting gender, especially in the aesthetic field.
Okay.
So companies now are more and more targeting men in the surgical and non-surgical aspect. I'm going to start with surgical, and then I'll give you the non-surgical, which already you know. Surgically now, there's a new technique. It's called U-graft. It's ultrasound graft. So instead of throwing the fat, we are injecting it in the biceps, in the triceps, in the deltoid, in the abs, in the latissimus dorsi, in the trapezius. So we can create muscles and using fat. This is brand new. This is done by few plastic surgeons in the world, which I'm one of them. So it's done under ultrasound. Not only you are sculpting the muscles, you are enhancing it. You are making them bigger in a safe way. So this is the biggest trend in male surgical health that nowadays we have. Do you have any questions about surgery, or we continue with non-surgical?
Non-surgical.
Okay, so let's go into non-surgical. Non-surgical, there's two chapters.
Okay.
There's the hormonal chapter and there's the machine chapter.
Yeah.
In the machine chapter, we have the EMS, which you have,
Yes,
the electrical
EMS,
muscle.
yes. We are also doing there too.
Exactly. You have it. You have the machine here.
Yeah.
So that's why I think you brought up the subject of men,
Yeah.
because they use it a lot. So for people that don't know, EMS, it's electromuscle stimulation. It's magnetic patch that goes onto the muscle and gives either a magnetic or electromagnetic stimulation to the muscle so it contracts. So for 10 minutes or 20 minutes that you do it, it's like 2 or 3 hours of going to the gym, because you're targeting a lot of fibers.
Fibers, yeah.
Exactly. So that's from one side of the machines. The other side is now there's a technology for erectile dysfunction. So more and more we're seeing machines, not for only women, for men that
too.
are having problems having children or sustaining any erection or anything in the medical term. So there are some waves now, shock waves, to improve the blood flow in that area. So this is also brand new.
That's amazing.
Yeah.
So mostly we see that the peoples have very myths regarding plastic surgeries. They think that if we do reconstructive surgery, maybe there be a physiological related problem in the future. So what you say about it?
Honestly, it depends on the doctor, because plastic surgery is very safe. Studies have shown it's very safe. We've been doing it for a long time. So if there's any physiological problem, would have shown. So there's no risk related to plastic surgery, but there's a risk related to selecting a wrong doctor or a non-plastic surgeon doing the surgery, or someone who never says no to the patient. They just say yes. So the best plastic surgeon says, the one who says no to the patient, you don't need it, or you have to lose weight before doing the surgery, or you have to stop smoking before doing the surgery, or we cannot do liposuction on you, we have to do a tummy tuck. It depends on how a doctor sees the indication. Because I can assure you, in my practice, more than half of the patients that come for either wrong indication, or I tell them, no, I cannot do your surgery.
Oh.
Of course, it's very normal. And I prefer being the doctor that says no than being the doctor that doing a surgery and having all the complications after.
Yeah. When people go for plastic surgeries, they think that we should not need to modify our lifestyle. There's no need for physical activity anymore. We have just done the surgery and that's it. So in here, Dr. Essa Diagnostic, we just start to focusing on the wellness services along with that. So what you said, that how much important these things are also along with surgeries.
Okay. You're bringing up topics that are new and very relative and very important. I love these questions.
Thank you.
So there's two sides of it. There's the lifestyle side and the adjunctive to surgery. So from the lifestyle side, you have exercise. So if you do not exercise, you do not maintain your weight, you do the surgery and expect the surgery is going to last for a lifetime, and you don't do the maintenance, that's at fault. So for a patient, and you're a dietitian, so for a patient, they should be put on a regimen before surgery with a proper dietitian, clinical dietitian. After surgery, because you burn a lot of energy after surgery, so you have to have a high protein diet, and later you have to maintain your weight. Plus exercise. You should wait after surgery 4 to 6 weeks so the muscles will not be sore. Then you should start exercising. However, from the wellness standpoint, from this center or my center in Lebanon, so the new trend now is in IV drips. So you have vitamins.
Yes, NAD and collagen
and
drips.
AD plus, collagen drips, glutathione, everything from this side. Plus, you have the adjunctive machines, which are the LED light therapy that can reduce swelling, the hyperbaric oxygen chamber that can improve, in some cases, the blood circulation. You have
blood circulation, collagen production,
exactly.
like the treatments, HIFU.
Exactly, all of these machines, the scar, the laser for the scar treatment. So surgery by itself is just one step. But there's steps before it and there's steps after it in order to enhance the result, to make it safe, and to maintain it in a long term.
Today, we see there are a lot of trends in combination procedures, combination surgeries, combination procedures. So, what you say about like how much the combination in the treatment, like if you are facing more than one or two, three problems, like in your body, in your skin, combination is how much important?
I think, look, to be honest, combination is very important, but depends on the case. For example, if you're looking at a patient that has loose skin after a tummy tuck,
Yep.
so you're doing an abdominoplasty. So you once you do the tummy tuck, you do the definition. We talked about the adjunctive therapies.
When people are in the surgery or after one surgery, they think that, okay, done, no more surgeries, and they leave their body like it happened. So,
No, that's what I was saying. So once you do a tummy tuck, you get the result. You have to maintain it. This
yeah.
is about maintenance. Combination is a different thing. So when you do a tummy tuck, it's done. You're doing it. You get the result. Now you have to maintain it. As far as adjunctive therapies or combination therapies, it's different. When we talk about combination therapy, it's like someone who needs a facelift but has very bad skin quality.
Yeah.
So in that case, a dermatologist should be done, a aesthetic specialist should be put in place in order to improve the skin type. So even if you tighten the skin, she will not have a good result if you don't do a combination therapy. Same if someone has cellulite, and we discussed it under the air. So if
Yeah.
someone has cellulite, you do the cavitation. If you don't have a good physiotherapist that does the Madero therapy and do the massages, you will not get the great result. So this is a combination when one problem needs multiple approach from different doctors or multiple treatment from one doctor in order to achieve a great result. And that is common.
That's really great. So, Joe, it was really interesting podcast with you from the forum of Dr. Essa. What message do you want to give to Pakistan, to our Dr. Essa family, and all the amazing doctors who are working?
First of all, I'm gonna say a special thanks to you for
Player. It's
making
it's
this
player.
possible. That's first thing, because we met yesterday. You've been very nice, like most of the people that I met in Pakistan. But honestly, it's a pleasure that I got to meet a new friend in a,
Thank
in a,
you.
in the same continent but a different country. Secondly, thank you for this establishment for making it possible for the studio, because you're letting me portray my opinion and my voice to this culture. My last advice for the people in Pakistan: please go to a specialist. Don't go for the cheaper option. Remember, you can buy 20,000 cars in your lifetime, 5 homes, multiple dresses, multiple clothes. You only have one body. So you have to treasure it. And you sometimes you buy a car and you say, yeah, I'll spend $2,000 more to get the brand new model or an enhanced trim or a new color. But nobody think about, yeah, but maybe if I spend $2,000 more for this particular doctor, it's important. Just I'm portraying, look at your priorities, select the good doctor and the good esthetician in order to get the best result without complications.
Thank you so much. Today we have an amazing guest, Dr. Joe, and we are blessed there in Pakistan at Dr. Essa Forum. You are there. So hope you like this episode. If there is any question regarding the podcast, you can ask in the comment section. Stay tuned. We'll see you in the episode. Allah Hafiz.